Welcome! In phlebotomy, it's all about breaking the chain of infection, not the chain of safety. This guide is all about helping you master infection control, not just to ace your certification exam, but to keep every patient and every sample you handle safe, every single day.
All right, before we dive deep, let's kick things off with a question. This is a big one. You're going to see it on your exam for sure, and you're going to live it in your career. So what is the single most important thing you can do to stop the spread of infection? The answer might seem obvious, but trust me, it's the bedrock of everything we're about to cover.
Okay, so here's our game plan. We're going to start with the basics, the universal foundation that applies to everyone. Then we'll layer on those transmission-based precautions. After that, we'll get into the nitty-gritty of mastering your PPE, keeping things aseptic, and then touch on some special isolation scenarios. And of course, we'll wrap it all up with the key takeaways you'll need for your exam.
Okay, let's get into our first section. This is all about that universal foundation. Think of these as the absolute non-negotiable rules of the road for every single patient you'll ever interact with. This is your baseline. So what are standard precautions? It's really a mindset. The big idea is that you treat all blood, all body fluids, well, except for sweat, and any broken skin as if they're potentially infectious. It's not about guessing who's sick. It's about assuming every situation has a potential risk. That's how you protect yourself, your coworkers, and your patients. Every single time. Now, what does that look like in practice? Well, here are the core pieces. We're talking hand hygiene before you touch a patient and after you take your gloves off. Wearing gloves for every single draw. No exceptions. Using safety needles and never recapping them. Disposing of sharps right there at the point of use. It's not about picking and choosing. It's about doing all of these things every time to build a powerful wall against infection. And this whole process really starts right at the front door. We're talking about respiratory hygiene. This isn't just for special isolation rooms. It's a universal thing. It's about giving a mask to someone who's coughing, having hand sanitizer available, and keeping some distance if possible. It's truly our first line of defense.
Okay, let's talk about the classic hand washing procedure. Mastering this is it's absolutely crucial. The key part here, that 20-second scrub. A really great trick is to hum happy birthday to yourself, twice. It sounds silly, but it's the perfect amount of time to make sure you're really getting in there with firm friction and getting rid of any germs.
So a big question for your exam and for real life is, when do you use soap and water versus an alcohol-based hand rub, or ABHR? Think of it this way. ABHR is your fast go-to for most routine draws when your hands look clean. But, and this is a big but, if your hands are visibly dirty, or if you've been around a patient with something like C. diff, you have to use soap and water. Why? Because alcohol just doesn't kill those tough C. diff spores. It's a non-negotiable.
All right, so we've got our standard precautions down, but what happens when we know, or at least suspect, that a patient has a specific bug that spreads easily? Well, that's when we add extra layers. This next part is all about those transmission-based precautions, airborne, droplet, and contact. I like to think of these as extra layers of armor. Your standard precautions are your everyday uniform, right? But when you're facing a specific threat, you add specialized gear on top of that. And that gear depends entirely on how that particular germ travels. This table right here is basically your cheat sheet. It lays it all out. You've got airborne diseases like TB or measles. For those, you're looking at a special room, a closed door, and an N95 respirator. Then you have droplet like the flu. That requires a surgical mask. And for contact, think MRSA or C. diff. That means gloves and a gown are a must. This is the logic you'll use every time you walk up to a door with an isolation sign. Okay, test prep alert. This is pure gold for your exam. I'm not kidding. If you remember nothing else, remember this. Airborne equals an AIR room plus an N95. Droplet equals a surgical mask. Contact equals gloves and a gown. Burn that into your brain. Knowing this cold is going to get you easy points.
Now, when we're talking about airborne precautions, it's so much more than just the mask. The room itself, that AIR with its negative pressure, is part of your protection. The door has to stay closed. And that N95 respirator, it has to be fit tested just for you. They all work together as one big system to keep you and everyone else safe.
Okay, so we know what PPE to wear, but just as important, maybe even more important, is how you put it on and take it off. This is called donning and doffing, and doing it right is what keeps you from contaminating yourself. Putting on your PPE, donning, is pretty logical. You go from cleanest to dirtiest. So first up is the gown, then your mask or respirator, then your goggles or face shield, and the very last thing you put on, your gloves. And a key detail here, make sure you pull those gloves over the cuffs of your gown. You want a nice, tight seal. Now, taking it off, doffing. This is where people mess up. It's the moment of highest risk for contamination. So the order is basically the reverse. You go from dirtiest to cleanest. What's the dirtiest thing? Your gloves. They come off first, then your face shield, then the gown, and the very last thing you take off is your mask. But here's the kicker. You do that outside the room after you've already left.
And listen, this is so important. As soon as you step into that room, you have to think of the entire front of your body as contaminated. That means you can't touch the front of your mask, you can't adjust your goggles. You need a really disciplined technique to take it all off without getting any of those germs on yourself.
Let's zoom in on a few key details for doffing. When you take off your gloves, you peel one off with the other, so you never touch the outside with your bare skin. Goggles, handle them by the earpieces or the strap. The gown gets rolled up, dirty side in, away from your body. And that mask, you always remove it by the straps. These little details are what make the whole process safe. All right, so we've talked a lot about protecting ourselves, but our job has another huge responsibility, protecting the integrity of the specimen. And that's where asepsis comes into play. It's all about techniques that protect the patient from infection and protect the sample from contamination.
Here's a distinction that you'll definitely see on your exam: medical versus surgical asepsis. Medical asepsis is what we call clean technique. It's what we do for a routine blood draw. The goal is just to reduce the number of germs. Surgical asepsis, on the other hand, is sterile technique. This is for way more invasive stuff, like an arterial puncture. Here, the goal isn't just to reduce germs, it's to eliminate all of them.
Now let's talk about prepping the site. Whether you're using plain old alcohol for a routine draw or something stronger for a blood culture, there is one rule that is absolutely golden. You have to let it air dry completely. Seriously, it's not just a suggestion. The antiseptic needs that time to actually kill the germs. Plus, if you stick a needle into a wet site, it can sting the patient and even mess up your sample, causing hemolysis. So let it dry. And just so you know, this isn't just me saying this. The official guidelines from CLSI say you have to let it air dry. They also say that if you clean the site and then accidentally touch it again with your glove, guess what? You have to start over. The prep is invalid. You got to clean it again.
Okay, let's switch gears a little and talk about some special scenarios. These are situations you're gonna run into where you have to adapt these principles.
First up is something called empiric precautions. This basically means when in doubt, play it safe. You don't wait for a lab test to come back. If a patient comes in with symptoms that could be something serious, like a specific kind of rash that looks like chickenpox, you go ahead and put them in the right precautions right away. You act on suspicion.
Okay, this is another huge exam topic: negative versus positive pressure rooms. A negative pressure room, your AIR, is designed to protect people outside the room. The air flows into the room, so germs from a patient with TB, for example, stay put. A positive pressure room does the exact opposite. It protects the patient inside the room. It blows clean, filtered air out of the room, keeping hallway germs away from someone who is severely immunocompromised, like a transplant patient.
And here's the memory tip you need. It's super simple. Negative protects the neighbors. Positive protects the patient. Got it? Easy.
And then there's the NICU. Working in the neonatal ICU is a whole other level. These tiny babies are so incredibly vulnerable. A small mistake for an adult could be absolutely devastating for them. That's why everything is so strict. Single-use supplies for every baby, super careful heel sticks, and absolutely mandatory bedside labeling to prevent any mix-ups. Everything is about protecting these little ones. All right, we've covered a ton of ground. Let's wrap up by focusing on the absolute key takeaways, the stuff you really need to lock in for your certification exam.
When you get those scenario questions on the exam, here's how you should think about them. It's a 3-step process. First, identify the route of transmission. Is it contact, droplet, airborne? That will tell you, second, which PPE and what kind of room you need. And third, throughout that whole process, you're always thinking, how do I protect the quality of my specimen? That's the formula.
And please avoid these common mistakes. Things like forgetting a tube and having to go back into the room, or putting your clean labels down on the patient's contaminated bed table, or wearing the wrong mask for the wrong room. These are the little things that can cause big problems, both on your test and in real life. Always be prepared and always read the sign on the door. Okay, one last number to burn into your memory. Ready? 2.0 millimeters. 2.0 millimeters. That is the absolute maximum depth for a heel puncture on a baby. Any deeper, and you risk hitting bone, which can cause a really serious infection called osteomyelitis. I promise you, you will see this number on your exam. You know, at the end of the day, it's not all on you. Your personal discipline is crucial, yes, but it has to be supported by a reliable system, making sure rooms are always stocked, that you get ongoing training, and that there's a real culture of safety. When you have both, that's when everyone is truly protected: the patient, you, and the specimen. So let's circle back to that very first question. What's the single most important action? It's hand hygiene. It all starts there. It's the first step in this whole chain of protection. When you master all these principles, you're doing so much more than just drawing blood. You become a critical link in the chain of safety. You're the first line of defense. The question is, are you ready to be?